Today we are tackling a common yet often misunderstood condition, gastroesophageal reflux disease, also known as GERD. Millions of people suffer from symptoms which can significantly impact the quality of life. To tell us more, we have Dr. Raza Sharif joining us to tell us more about this condition that I think, a lot of people have heard of, doctor. Perhaps they wonder if they have it, but they don't know enough about it. Thank you for your time.
Yes, thank you so much for having me on your show.
Of course.
GERD is indeed a very common problem. It affects more than 1 in 5 adults. And rather than just simple heartburn, GERD is more involved. GERD or gastroesophageal reflux disease is the reflux of stomach contents into the esophagus, into your food pipe, and it could be both acid and non-acid reflux. GERD can sometimes, the reflux can extend to your throat and into the airways and can give to breathing problems. And in severe long-standing cases, it can also damage the lining to the food pipe and predispose to cancer and precancer. So it's certainly more than just heartburn.
Yeah. How do we really tell the difference, though, between your normal and occasional heartburn and GERD?
Good. So like you said, GERD can just be simple heartburn, but it can also be chest pain. It could be bloating, burping, regurgitation, especially when you're laying down. In some people, GERD could present as difficulty swallowing. It could present as a sensation of a lump in the throat. And like we said, it could also cause breathing problems. The GERD can present as chronic cough and also as worsening of asthma. And in fact, studies show significant association between asthma and GERD.
Very interesting. And if someone were to be diagnosed with GERD, I think anytime we hear that we are being diagnosed with anything, it obviously is scary, it's alarming. What should those who are diagnosed with GERD know about treatment options?
Yes. So GERD is most commonly treated with acid-reducing medication, and in most people, the medications are effective. But there are some people in whom the acid-reducing medication doesn't adequately control GERD, especially in someone who has non-acid reflux. And also for somebody with long-standing GERD or somebody who's concerned about the side effects from medications, there are other treatment options. There are surgical and endoscopic treatment options which actually work on the real physiology of the disease and can provide uh, pretty effective relief from both acid and non-acid reflux.
Very interesting. And I understand to learn more, you will be having a webinar happening on Wednesday. It's all about understanding acid reflux versus GERD. Can you tell us a little bit about that quickly?
Yeah, absolutely. So we're hosting a free webinar. It's Wednesday evening, where we'll really be talking about the disease process. We'll talk about the workup of GERD, including endoscopy, and really about specialized testing to accurately diagnose GERD and to assess disease severity. And for those who are interested, we will be talking about surgical and endoscopic treatment options.
Very interesting. Dr. Sharif, thank you so much for your time.